just wanted to do a small summarize of the next part that you're gonna see that is called pre-op. So in the next part, you're gonna see where I am talking about my pre-op appointment. I just want to clarify that on the pre-op appointment, medically, they just repeat exactly the same eye checks as they did on the free check, the free one that each clinic provide, each surgeon provide. So, and they, with the only difference that they dilate your eyes or your pupils, which they inform me in advance that this is gonna happen, which I gotta say, very good. They also inform me that I'm gonna, after the pre-op, I'm gonna receive a package with the information to sign the consent for surgery. Good thing. So the paperwork they didn't do with me for some reason. The total pre-op appointment was very fast. They were very efficient on that, I gotta tell you. Also on the pre-op, I was trying to pay, and this is when I find out that this doctor max out the patient, which means that you pay the maximum state allow price for this surgery in this office. And basically there was not much information given to me regarding the payments or the charge or how they do this. It was just check of the eyes. I try to pay with my care credit information that they give me in the beginning of the year. I think it was in May. They gave me this Deflian over here. You would see it in the other video. And that was it. And then they let me go with no information. There was zero information about the payment, zero information about safety or anything like that. There was no information. I went home and I did call them, and they told me that I'm gonna have a pre-op call where somebody is gonna give me a detailed information 1 week before surgery, which was the beginning of November. They normally should give you this so you remember. And so as I am not a specialist and I don't know how the pre-op should happen, or at least I have done a few pre-ops for other patients, but I didn't know how this office work. I said, okay, maybe this office is a little bit different. They're gonna give me the safety information in the pre-op call. The pre-op call happened once again. If I have to give from 0 to 10, I will give 2 to this pre-op call. Once again, the reason why is because they repeat the information that they had. I have printed them, my allergies. I have a copy of it. So I bring them printed copy of all my allergies, the medicine, the reactions, the ears. Is all here. I type it down, what kind of problems I have with allergies, and that I'm allergic to latex. So during my pre-op call, she started asking about the allergies. The call was very short. I said to her, ma'am, you have the information already there. I don't understand why you ask me when I bring you the paperwork. You should have it there. Can you open my chart? So she go over my allergies, but she, on the pre-op, what was repeated that I had to purchase the medicine. No, don't forget this prednisone, because their office for some reason decides to make me pay separately for this. So she repeat that you have to do this, and the second thing that they repeat is that I have to do the COVID test. They didn't give me no instructions about my safety. That's about it. And here I'm gonna stop with that. Here it's my COVID test. As I did, it says antigen negative. I had to do this for surgery, and this is the drops, $55 plus tax that I had to pay. This is a prednisone, acetone, optahalm, suspension USP 1%. This is steroids, which the office should have provided, but they did not. But said that I did the COVID test on the November 13th, and my surgery was in the 16th. So that's about as much as that I'm telling you, that's what I received. Also, I did receive the package with information, which was the consent form for surgery, and I do have it here actually. 25 pages. Obviously, you do not read them all, but inside of this package, there was information talking about the payment method, talking about the emergency, where to call, whom to call, which was a good thing. Risks of PRK, and the payment, $4,000, last page that you actually sign before surgery with the consent of surgery. And this is pre and post-op instructions where it says what kind of documents to bring with yourself. Once again, nothing much that they remind you to do or not to do. So I would say that the pre-op appointment, medically, they make the checks, which is good. Okay, blink, smiley faces. But on the pre-op call, they didn't give me much instructions about how to get ready, what not to do, simple things like that. I feel like they lack of instructions there. And there was like, oh, do you have any further questions? Well, imagine somebody that doesn't know anything about surgery and they don't give you that information and they're like, do you have any questions? So the pre-op call, I will give it 2 out of 10. The pre-op appointment was good. I will give it 9 out of 10. The only reason why is because they didn't discuss any financial questions with me, although I make it clear that I wanted to pay, I wanted to address this question, but there was a zero information about that. They skip it. They were like, wanted to hurry you. They wanted to send you home. Obviously, you don't want to spend all day in the doctor's office, but there was no addressing this matter whatsoever for me. One thing. And the second thing, yeah, they just tell me that I'm gonna receive this package to sign online, which I did, which is to cover the doctor's office against suing them and so on. But it was nothing much about you as a patient, you as an individual, you with your eyes. There was zero, nothing there. And the pre-op, so that's why the pre-op appointment, I will give it 9 because they make all the checks that they had to confirm that will be safe. Okay, bravo to you guys. They also give me shades to drive with. Okay, thank you very much. Pre-op call, I will give it 2 out of 10. The reason why I give it 2 out of 10 is because they didn't give me much instruction about how to get ready for surgery. They only tell me that I should wait in my car and call them, and when they are ready to receive me, I can get up there. That's it. I didn't feel like they cared for me, you know what I mean? So I would say the pre-op call, I separately vote them. I would call it bad. I would give it 2 out of 10. 2, 1 because happened. The second because they did address my allergy, or they tried to ask me once again, although it seems like they didn't care much to read about it. No instructions. No, there was no instructions about makeup or cream or anything like that. And the only reason that I knew it was because I was watching a movie. I was watching a YouTuber talking about it, and this is why I'm making this video. So that's about it. You're gonna see my very fresh recording. I did it 1 week after surgery with my shades. You're gonna see it is about 20 minutes that talk very detailed in pre-op appointment and pre-op call. That was just the 2 things that I omit. And here is the next part. Deshler. And things that make me feel uncomfortable. I don't do this surgery every day. I don't know how it's supposed to be done. Things that I find very, very good about this office, and how I feel with my vision today. Today is day 5 of the procedure. So, if you see the previous video, I shared why I choose this doctor's office. After I visit all these 5 offices that all had close to 5-star reviews, I felt very confident with this doctor's office. I repeat again, I did not meet the surgeon on the free consultation. I didn't meet it in the pre-op. I didn't meet him until the time that he actually performed the surgery on me. So if you're interested to know how it's like to have a PRK, you could stay here and watch this video. So as I said, I visit the doctor in the month of May. Then I travel to Mexico, then I travel sometime to California. So I knew that I wanted to do my procedure in fall because the sun isn't as strong, and I knew from reading that after the procedure your eyes are very sensitive to light. So I wanted to choose more gloomy weather, naturally gloomy, so I would be less disturbed, although I am disturbed with the light. And it's day 5 of the surgery, and that's why I wear those glasses. It's not like I'm hiding from you guys, forgive me, but it really, these glasses really makes a difference. It makes me feel comfortable. So the pre-op appointment I had in the month of October, precisely October 26th, and it was in the evening. I have this right here, my note. So when I called him and I told him that I am going to, somebody's texting me, but I will ignore it. So I called him and I said, okay, guys, hi, I choose your office. Can we go with the pre-op? We scheduled the pre-op in October. Then we scheduled the surgery, which was for me November 16, and the post-op. So we made the 3 appointments right away. So on October 26th, I gotta tell you that the office receptionist, I wanna congratulate the girls that work there, and also the doctor or whoever recruit those ladies. They are very, very polite, very kind, very professional. They did answer a lot of my questions on the pre-op. They explained me a little bit what to expect, and they did prepare me mentally and clarify for me that on my pre-op appointment I am going to have my eyes dilated. They also tell me not to worry, that they're gonna give me these shades that I will be able to put after that, to save myself from the discomfort from the light. They explain me why the dilation is necessary. So basically on the pre-op appointment, once again, they check your vision, they check your if your vision changes. And in this situation, it was 6 months gone from the first appointment that I had. So they confirmed that my vision isn't changing. They see my glasses, they check how I see without the glasses. They again measure the thickness of my cornea. They dilated my eyes and they repeat the whole test again. I am not sure the lady, I don't know why in my head she's Italian, but I know she's American lady, brunette, that did this for me. A very pleasant lady. So she make all that. We confirm. We confirm for the PRK. And at this time, 26th of October, I already had applied for the care credit. I received it. They even give me a little bit more money than what I request. I just wanted to pay for the procedure, and she said we normally. Um, so she did the entire test, and after this we proceed with the payment. Although I understand that the office did not charge me until the day of my surgery, but this is another topic. So the pre-op was pretty smooth. We just confirm everything. We make sure everything is safe. And then they told me that I'm gonna receive a packet, which I did, where I have it printed somewhere, but it's not here. But it was about 25 to 30 pages, where they explained to me what to expect after surgery, the hazy vision, the sensation, not having a clear vision for the first few days for sure, the risks, the negative side, eventually side effects. Very, the whole thing was written, the consent for the procedure and all that. And I had to sign it online. Basically, nobody went over it with me, but it was sent to me in a written form, and I had to sign it online, which I thought it was pretty comfortable, although it was a lot of pages to read. The good part, in my opinion, was that it was written very detailed, the possible negative side effects, and so on and so on. Also, in this document, they give you all the information about the eventual situation post surgery, and also there was a piece of paper. I'm sorry, I don't have it here. It's on my fridge. Where to call if you have experience something severe after surgery. It's on my fridge actually. They have 24-hour line where you can call and address things that may disturb you, which also give me a very good feeling, or like safe feeling, that if something I feel weird, I can call this line and I can ask information there, which I think it's a great thing. Congratulations to this Dr. Dishler Institute, because I think the calmness of mind, that if you feel bad or ill or uncomfortable, that you can call somebody 24/7. It changes a lot about how you're gonna experience this process. Also, in this folder that they sent me the request for mandatory COVID testing before surgery. And they also tell me that I can do it whenever I want. They give me a suggestion to a lab. Again, a great job, because some people that are not in medical are very challenged to do this. So I find this extremely caring for the patient, that they would give you this information, request you, and give you the information a few days where to which email to send your results. Also, this paper advise you to isolate for 2 weeks before surgery, uh, to prevent getting coronavirus, to prevent getting any kind of infections, and also to make sure that your test is negative, because, by the way, you pay the surgery out of pocket. So I suppose that if you have a positive COVID test, you cannot have the surgery, and or you have to reschedule it. So self-isolation, it's recommended. Obviously, they cannot oblige you to do so, but they strongly recommend the 3-4 days before surgery, just to limit your contact with people. For me personally, as I did pay out of pocket, I mean, care credit, I'm still paying it, but I just wanted to make sure that I am able to do the surgery. I did self-isolate from date, probably 1st of November. And the only people that I saw, it was the people who drive me to the procedure. Maybe like 10 days before I saw one person. Uh, but that was it. I did not have any contact with anyone. Basically, I was isolating or just working, walking to the park and back home. Like I didn't have any contact, right? So the documentation that they sent, it's very detailed, very, very good. I want to say they did a great job organizing this thing. Was though one little thing that little bit disturbed me on the pre-op appointment. Um, as the doctor maxed me out, which means that asked me the maximum amount of money for the procedure, and I was informed that the medicine are provided by this doctor's office, all the necessary things. For my surprise, on my pre-op, the nurse gave me a prescription for something that she called steroid drops. I didn't know at the time what was this exactly about, so I just take the prescription. I said, okay, maybe some kind of a drops. Um, and of course, I do have state insurance. I was saying, okay, it's okay. Maybe they will cover some of it. So I had to go and get these drops. Um, they are right there. It's steroid drops called prednisone, and have them with me on the day of surgery. So I had to purchase them. So I went to the pharmacy, and I discovered that the way this doctor prescribed this medicine, he wanted to make sure that I pay them out of pocket, that I cannot use my insurance. I did not understand why. Is that because if you already max me out and I was promised that you're gonna provide all the necessary medicines or drops for my surgery, why you request me to spend I think it was about $70 for the drops. Why did you make sure I spend extra money for these drops? Didn't I already pay you for the entire process? This thing, my apology, doctor, it, it just make me feel not okay. But anyway, I decided to do the procedure, so I purchased the drops and I went to, I had them ready for surgery. So that was more or less everything about pre-surgery. Regarding the COVID test, I went to a place called, I believe it's called Lab Care. I'm apologizing, I just changed my phone. But so there is a different places that you can do COVID tests. Some of them are outside on parking lots on strange places. You can do it some Walmarts. No, I'm sorry, Walgreens. Walmart give you the vaccine. Walgreens, you can do the test, and Walgreens proclamate that you pay zero. In my case, I was able to do the rapid test. Um, that is called a lab care, and I will tell you, I had a great experience with this place. I'm gonna list their link below. If you do need a COVID test, they accept most of the insurance. I did text them on Saturday morning. They have a texting system. A gentleman assisted me. He found an appointment the same day, and I was not able to fill all the information online, but I just drove to the lab. As it's COVID, I waited in my car. I would tell you, it was excellent. They were able to use my insurance. I did pay a copay, and I had the result within 10 minutes, basically. So I was a little bit worried about this because you imagine if you have a positive test, you have to reschedule your surgery and have all these emotions again. Uh, excellent service. Excellent service. I will leave the lab link below if you do need a COVID test. I do recommend them. It was a very rapid, organized, professional, kind, everything. So I sent this test, no response, obviously. Anyway, the surgery date. I arrived there, they instruct me to call from the car, and they will tell me when I can get up. For my luck, I didn't wait any time. The receptionist told me, please go ahead, ma'am. Please wear mask, no visitors. Wonderful. I give them the number of my driver, and they had a separate chairs for every patient or every person who was going to have a surgery these days or at this time gap. So there was a special chair for me. They put me to sit, and a nurse, her name was Marta. Marta come and she stick first this one on me and then this one on my hands, these two bracelets with my name, saying what surgery I have. And here in the bottom, it names the medicines that I'm allergic to. And then this band was put it on me because I have a reaction on latex, and they explained me that they will use a different type of gloves and different type of products to prevent reaction to that. Again, I congratulate and I want to compliment this doctor's office because they are attentive to you. I would not say 100%, but a big 90% I will give them, because there were a few things also later on I'm gonna share that they were not so attentive to. But I would say that this was very good. I will go back a second and I will tell you that after my pre-op appointment, they didn't tell me nothing about the surgery day itself. So I called and I speak with someone on this emergency line number, and she clarified to me that a nurse will call me about a week before the surgery, and she will go all over with all the instructions. I did have a nurse call me about a week before the procedure, or it was the Monday the week before my surgery, and she told me, like, don't exercise. She didn't go in a lot of detail about how the surgery will go itself, what is the procedure there. She basically repeat a little bit the information that I read on this paperwork they sent me. She asked me if I have any questions, but you understand yourself that, like, you don't have this surgery done 10 times a year. So it's not like I can have a questions because I'm not aware of the process. Now, if I have to do it again, I would eventually had some questions, but not being aware of what is gonna happen, obviously I couldn't have any questions. She go over the LASIK allergy to to latex, and she asked me if I have other allergies, and I said, excuse me, ma'am, last time that I come I printed entire page and half describing in detail what kind of medicine I have allergy and what kind of reaction I have. And I don't know, maybe it was somebody new or they didn't check my chart. But this was a little bit something that made me unease during this call, because it seemed like she didn't check my chart and she kind of wanted me to go over this again. And I said, ma'am, you already have the paper there. Please check it out. It's detailed, all the allergies that I have. Uh, and she said, okay, she would do that. And so this is how we stopped there. But the only thing that she told me about the day of surgery is that I have to stay in my car and call them, and they will ask me to go there in. The duration, she said, between 1 hour and a half and 2 hours. but the entire procedure will be about 20 minutes, no longer, but it's just the preparation for this procedure. And that was it. 20 minutes call. I would say one little thing here. I don't want to be like a capricious person or anything, but I do pre-op calls for other people when I interpret, and I don't I don't think and I don't feel like this nurse explain me in detail and prepare me psychologically what should I expect on the day of surgery. Nothing about what should I wear, nothing about it was just a lot of information was skipped. And even if I work as a medical interpreter, I do still believe that I deserve to be informed for my own surgery, my own safety. They didn't mention if I can put a cream on my face or no. There was a lot of things that they did not mention that they should have during this call, um, which, which, if I was not a medical interpreter, would have created problems in the surgery time itself if I use a cream or something. So I would give a minus here. So I'm gonna give them to the pre-op call. If I have to validate, I will give it 4 stars, not 5, because I don't think I should ask those questions, but I think that you, my provider, being a specialist in your field, should inform me about what is not to be done on the day of surgery. That I don't have to put a cream, things that I'm not supposed to do. Otherwise, she was polite, kind, friendly, and everything.